All right, everybody, Hafaday, and welcome back to the show. Thanks so much for watching again here on KUAM. Now, the two beautiful ladies that are joining me right now are not only very strong, very learned Guamanians, they're also very, very concerned with mental health here on island. I'm very pleased to be joined by Annie Unpingco and Dr. Lilly Perez. Ladies, Hafaday, thank you.
Thank you. Yes, mental health is really important because it's about our mind, it's about our brain, and we all have that, and it affects the rest of our body, our functioning.
And of course, we are now in the month of May, and as you may probably notice, the three of us are wearing green. Green is the color, so if you have green, we want you to wear it as often as you can through May, because Dr. Perez, May is Children's Mental Health Month. Now, what does that signify?
Well, first of all, public awareness. So we're really promoting that because an ounce of prevention is worth a pound of cure. And so we figure if we get folks involved early enough, the problem doesn't grow and blossom into something that's unmanageable. So between the two of our programs with IFA Magonta, and they deal with youth from 5 to 21, and Project Carinu, we deal with youth from birth to 5. Between the two of us, we create one system of care for Guam.
Now, Annie, how widespread is the issue of children's mental health here on the island, and approximately, how many children are affected by mental health issues?
Well, if we look at our population, probably we can say 60,000 are young people, so I would say about 12,000 are affected or have some mental health challenges. And we see this a lot of times in the school setting because there are certain expectations that they are required to perform, and when they are struggling, oftentimes it has to do with some lacking skills or challenges that they face in life. It's really difficult to be a kid nowadays. It's easier, I think, when I was growing up, the life was simpler. Now there are just so many influences and temptations, I think.
Yeah, and peer pressure is on a level, Dr. Perez, that it's never been before. And how much of, like as Annie just said, maybe roughly 12,000 kids are affected by mental health. How much of that is naturally occurring, and how much of that is imposed by various types of behavior?
So in the program that I work with, which is called Project Carinu, we're working with the kids from 0 to 5 and their families. And so we don't see the cases that necessarily have as much of the psychosis, unless, of course, it's the parent. And we've had a few where parents have been the primary cause of concern, and we use the child to help educate the folks. So I just wanted to make that distinction. We have to date about 500 cases, and we've been servicing children for 4 years. And so this is 500 referrals, which is about 125 a year that have come through our door. Yeah.
Well, that sounds very obviously voluminous, and obviously that's a lot of work for the both of you and your colleagues. So, thank you for what you do for the community. So on that note, what is being done to create awareness and make the community know about what types of services are available?
Well, this week is Children's Mental Health Week, and we start out with a mass yesterday at 2 different locations, the New Covenant House and also actually it's New Covenant Church, not a house, and the cathedral. Yeah, and then today we have proclamation signing by the governor, and then we have open house. Carinu has it on Wednesday, and we have it on Thursday, and then we have the wave. But along the line of the proclamation, we are giving out ambassador awards to people that support our champions in systems of care from all over the community. I just want to say proclamation signing, it's once a year, but we really need to be mindful that mental health is not a once a year kind of thing or once a week. It's every day of our life. We need to be mindful of our mental health and how we take care of each other.
Absolutely. Well, I see you've got one of these lovely green
My button.
Yeah, green ribbons. Where can people in the community get that if they'd like to, show their support and, in their own way, make other people aware of children's mental health?
Well, they can call us at Ifamagonta, and we have a few. We can't give everyone, but we'll try. So if you're interested, come and we'll give you one.
No, please.
I think, Annie, last year we had a parent who actually made them from coconut leaf, the fronds. It was very nice.
Very
yes,
cool.
Yes, and local.
Okay, so how else can people get involved, Dr. Perez, about with issues of mental health? And we'll wrap up with this question. But what can people do if they are just concerned, and so many people are when it comes to the welfare of children?
I want to encourage early screening. There are so many programs now that do the early screening, besides Project Carinu. They'll do screening also at Ifamagunta, but KUAM Early Intervention System does screening. Head Start does social emotional screening. So if you're concerned about your child and you're thinking, well, something about my child isn't right, get your child screened and check it out. That's a good place to start. And then from there, necessary referrals are made, you know. So don't ignore the early warning signs. And, you know, don't forget, parents, your mental health counts too, not just your little ones.
Exactly, and that's a very good point. And as you've told us so many times over the years, knowing is the first step.
Yes.
All right, so ladies, thank you so much for what you do. Si Diyos Masi.
Thank you, Jason.
And come back anytime. All right, and you out there in TV land, thank you so much for watching. That's it for our show. We'll see you next time. Adios.